Okay, I see that people are starting to join, right?
Wonderful. Hello, everyone, and welcome. I'll just give you a quick reminder about how this works. So if you have any questions for our panelists, which I hope you do, please post in the Q&A box found by clicking the black navigation panel at the bottom of your screen. If you see a question there that interests you, you can click the thumbs up to let us know that it's popular, and we'll try to get to it sooner. If you would prefer to ask your question out loud, and we definitely invite you to do that, so it can be more of a conversation, please raise your hand, or I think there's an option to request to speak, and Anelia will allow you to turn your microphone on. So just a reminder that all questions are very welcome. This is not a structured conversation at all. So any topics at all that you feel like bringing to the floor, we're happy to address. I'll just introduce you to our speakers who you may or may not have met before. So we have Julia Challinor, who serves as a consultant for multiple international projects for childhood cancer and pediatric oncology nursing, including the AFON Spanish chemotherapy / biotherapy course in Latin America. And she is also currently Secretary of SIOP, Secretary General of SIOP, sorry. We also have Guillermo Chantada, who is the head of outreach program at the Pediatric Cancer Center Barcelona at Hospital San Juan de Diu. He's also scientific director of hematology oncology service at Fundación Pérez Scremidi in Montevideo, Uruguay. Apologies for my pronunciation, everyone. And principal researcher for the National Council for Research and Technology at Buenos Aires, Argentina. And of course, here in his capacity as president of SIOP. We may also have another panelist join us later, which will be exciting, but for now, feel free to bring your, or even if you want, well, just turn off your microphones and say hello.
Yeah, thank you very much, Nancy. It's a great opportunity that we have today. This is the second time we do this. We open our office. We just welcome the members, the SIOP members, to come to join us, to ask us questions, give suggestions. You know, we also have our membership survey that many of you have already answered. So it's a great opportunity. We are very happy to be here with you, spending time with you, trying to answer the questions you may have and share quality time with you.
Indeed, I'll pick up on that. We decided, Guillermo had the idea that we would do outreach during the year as opposed to only during the Congress. And so we're hoping that these two open forums that we're holding to try to capture most time zones is helpful for the membership to have a chance to go one-on-one with Guillermo and myself, and an incoming speaker, incoming Secretary General in October, Regine Kabudi, who we're hoping will join us as a panelist as well today. So this is really to get a feeling of what you all are thinking about, what you suggestions you have, things you think are going well. Any topic is fine. We try to answer. If we can't answer today, please let us know, write it in your chat, and we'll get back to you with an answer later. But it's an open forum. It's we call it in the US a town hall. So we're happy to hear from you and encourage you to put your hand up or write in the chat.
Nice to see all of you. I'm Anelia Tanasova, part of the SIOP office team, and we are welcoming all of your questions you may have. Thank you. Enjoy the session.
I see some familiar names in the list. It's great to be surrounded by friends. So please, I see that there's just one question. Oh, Trine and Anidia, I think
yeah.
Trine has.
Chat seems closed in my screen. You can type your question in the Q&A box if you have. Trine, a question you may want to raise. Yes, for attendees, chat is yes, thank you.
I think the chat has now opened.
Is it open? Okay, while we wait for questions to come in, are they going to be in the chat and the Q&A, Nancy, or are they going to be only in the Q&A?
Yes, I think they'll come in through both streams.
Both streams? Okay. Okay, so let me just say a few words while we're waiting for some questions or comments to come in. You can see on our screens that we're looking forward to the annual Congress in October in Ottawa, Canada. We recognize that's a long way to fly for some people around the world, but we're hoping that as many people that have the possibility to join will come. We had a tremendous turnout in Barcelona, first time back live. And I think it was really an amazing occasion to finally get back in person. And we felt that Guillermo and I had almost zero chance to attend any of the presentations. So this year, one major change we've made is that the SIOP board will no longer spend the 3 days of the Congress meeting with all the different organizations and key stakeholders that we used to meet with traditionally in the past. This year, we're going to do our board meetings before the Congress begins. And then during the Congress, for those 3 days, there'll only be 1 2-hour slot each day for Guillermo and I and the rest of the board members to meet with specific interested parties, because we felt it was really a disadvantage for us not to be on the floor at the presentations, hear what the attendees were doing and hear the science. So that's one major change you'll see hopefully at this Congress this year. Any other comments?
So you're going to see us. No, yes, you're going to see us walking around and being available for networking and questions. I think, well, the past year was crazy. It was crazy because probably for many reasons we're coming back from COVID, a lot to do, and we barely could get out of our room. It was really impossible, and we think that could make us closer to the membership. So that is, I hope that's going to be very, very important for SIOP and for the members. Yeah, I see the question from Trine. Great question, Trine. It's how does SIOP, what is success for SIOP, right? How are we are going to be in 5 years, or between 1 and 5 years, right? If we consider ourselves as successful. Well, that's a great point and very timely, because we are working on our update of our strategic planning. So we have arranged to have a meeting next year to discuss the update of the strategic planning. So there is really a vision for SIOP to really continue to work in the topics that we are adapting some strategies, adapting some objectives, and really hearing from you. I think there is a probably, if I can summarize, I think for the past few years, SIOP moved away from two big labels that perhaps SIOP had. One of them was that SIOP was a society that did a great Congress, which many people saw that SIOP was mostly that, not only that, but mostly that. And SIOP has moved in the past decade, perhaps. And SIOP is getting bigger, more diverse. There are a lot of things going on SIOP. And a lot of, probably thanks to the virtual world now after COVID, a lot of things are going on all the year around, and not just around the Congress, not just in September. And there's a whole range of opportunities, a lot of educational opportunities that we didn't have in the past, a lot of networking. We are going to have a new member platform that is hopefully going to be launched by the time we do the meeting in Ottawa. So you, as members, will have a very sophisticated platform where you can interact, you can network, you can work with the different cooperative groups, etc., with your continental branches, etc. So that is something that is coming, and we see in the past, in the few years, in the next few years, we hope that can be really a good transition from where we are now. We are probably going to have more online educational offers. So we are working also in having either a restructuring of how we present our virtual Congress or adding other educational activities with the continental branches. Some of them even can be in different languages than in English. And also something we have started to discuss is how we see the global health actions that SIOP is doing, moving again from what was being done a decade ago about probably what we call the PODC model, where what we called at that time developing countries didn't have or have a relatively low voice in the society, to the moment that as it is now, where it is fully integrated between low and middle income countries, high income countries, etc. So now that we achieved that level of interaction and networking, we are thinking of the next step and having SIOP as working in different aspects of global health, like health policy, etc. And I think I spoke too much for a question. I think probably Julia would like to add more. Sorry for taking too much time.
No, I think it's great. It's a big question. I think one thing working with the membership committee is we'd like to have more members. I think we're only as strong as our members, and I think that our attitude from the board through the secretariat is that we serve the members. That's the point. So we can't serve people if we don't hear from them. You know, we can have, and we have the big business meeting at the end of the Congress, but not everybody can come to Congress. So by doing the surveys, by doing the open forums, by doing outreach to try to get a sense of what the members see as SIOP and what the membership wants us to be, and also working through the committees and the networks and all the groups that work under the SIOP umbrella. I think the Global Initiative for Childhood Cancer from WHO has really put childhood cancer on the global map, so to speak, and I think we're getting more attention than ever before. I think that's both a good thing, but it's also difficult because SIOP is not enormous. We don't have millions and millions of dollars, and yet we're being called in to give technical advice. Guillermo always says one of the things that makes SIOP so strong is that the members come from so many places, that we are so inclusive, that we can point to so many countries. If you look at our membership map, where we have people who are taking care of children with cancer and know what's going on in their country, in their setting, in their region. And I think you'll see a bit of a shift recently over the last few years. And I think this will get stronger going forward in the next 5 years, say, the reliance on the continents and really considering the continental branches as experts in their regions and relying on them for advice when issues come up that are related to both the science, but the politics. Let's face it, there's a lot of politics in childhood cancer. As soon as there's money and an organization as big as WHO putting effort forward, our collaboration with St. Jude, we've got several collaborations, and we know St. Jude has a great deal of deep pockets and funding an amazing effort around the world for childhood cancer, but can't do it alone. We've got groups like World Child Cancer, Cancer Care, which Trine is associated with and managing, and groups in Asia, SIOP Asia, AFOG, INPOG. I mean, what we've seen over the last few years, I think, is more regional strengthening. And I think SIOP is there to support those branches as well. Would you agree, Guillermo?
Yeah, absolutely. Yeah, that is our movement from the different global health perspective that we are facing now. And you're right, we get bigger if we have more members, if our membership is more diverse. So that is a great objective for SIOP, absolutely. And
Thank you
may
both.
I ask? Oh yes, please, Nancy.
No, sure, Guillermo, you go.
No, I was just wondering if we answered your question, Trine, and if you had a big participation in SIOP. So if there's anything that we just summarize, but you might consider we should take care of that we didn't mention. Okay. Great, thank you.
Okay, well, thank you both for tackling that very big question to kick us off. And we have another one that's perhaps slightly related from Neil. He says, SIOP seems to be working in different distinct areas, and I can feel that happens at Congress. Is there a way that different parts of SIOP can work closer together? In particular, I'm thinking of global health networks, the Global Health Network and clinicians and groups from high income countries. And he doesn't just mean to benefit global health networks. So I'll see if I can find him in the attendees, and I'll allow you to talk, Neil. So if you want to add anything else, please feel free. And Julia, would you like to take this one first?
Sure. We are sensitive to the fact, as Guillermo mentioned a little bit earlier, that the PODC model, when it began back in the day, Hans-Peter Wagner, who had the idea years ago, really brought our focus to the fact that the majority of children with cancer were not being treated in high income countries, and we had to do something. And PODC was born and became very successful. And then in 2011, Trine Israels and Scott Howard at the Boston SIOP Congress restructured it so that it was more formal and I think clearer to the members what they were going to do and how they were going to task it. It formed into multiple working groups. At the time, I think it was 10 or 11. And that has continued to grow. And then about a year or so ago, the name changed. People were offended by the term developing and felt that every country is developing and that it was a negative connotation. And so the name was changed to Global Health Network because maybe it was, as Guillermo pointed out, a global issue rather than, or a global initiative rather than a pediatric oncology only in developing countries. And that goes exactly to the heart of what you're mentioning. There were a lot of what used to be called twinning programs. That's not a term many people use anymore. In fact, the twinning working group of PODC changed their name when it became Global Health Network to partnerships. So the whole idea of how people come together to support each other is evolving. And the whole way we look at Global South, which is a term that I've been told those in Australia and New Zealand are not happy with that term. Even the words we're using are not making people happy. And there's a lot of discussion in the literature about what is the right term, the colonialization, the racism, the inequality. And let's face it, as I spoke to an editor of one journal who's from Argentina, he said, you've got inequality in your own country in USA. And I said, that's true. So to point fingers at countries saying you don't have equal access, well, we don't in the United States either have equal access. And I would argue that there are places in every country where there's unequal access. So going to your question specifically, how does SIOP address this is something the board and the senior management team and the governance committee and GHN, Global Health Network itself, and all the co-chairs of each of the committees, we're thinking about how to best structure SIOP to address global health. And let me turn it over to Guillermo because he has a vision about that.
Oh, I don't think I can add anything else. Julia, you did a absolutely comprehensive answer to that great question from Neil. And one of the small things I may add is that I think that Neil perhaps is referring to that also, is that this new vision of the Global Health Network probably is more inclusive of other teams in high-income countries that are working in global health right now. Because as Julia said, 20 years ago, it was only to enforce the voice of the low-income countries in SIOP. Now there is that objective is done, and there is a lot of groups all over the world that are working in public health. And that is what SIOP wants to be, like a forum for all this group to come together, to have the discussions, to participate in proposals, and of course meet once a year at SIOP, at the SIOP Congress, to discuss these issues: how we tackle inequality, how we tackle human rights, how we tackle policy and governmental policy, how to do a cancer plan. For example, last week we were approached by a government of a country because they say, we have written a cancer plan and we would like your opinion as a society. That would never happen before. And we have to be prepared for that. We have to have the right teams working on that. And we already have the right people. So it's that the way we should think this network has to be organized and really address these emerging challenges as probably influenced a lot by GICC, that the world is changing, and a pediatric cancer plan from a government, which was something that maybe 1 or 2 countries have in the past, now it's a reality, and we are the right partners as a global society to provide opinion and on that. I agree with you. Neil, is there anything you might like to add?
Can you hear me?
Yes.
We can.
Yeah, no, that's really interesting. When I was first listening to Julia, I was thinking she's not really answering my question. But then as I did listen properly, she totally did answer my question. Yeah, because what I find is some people, they're just interested in global health. Some people are just interested in high income studies or whatever. But yeah, it needs a big shift in focus and mindset to try and get everyone to work together, doesn't it? And that's exactly what you said with the answering the first question. So no, it's very interesting. But yeah, how we do it is quite a challenge, isn't it? But thanks for both the answers.
Oh, thank you, Neil. So thanks for your question and for all your input over these years.
Brilliant. I wonder if anyone else from the audience has any questions related to this topic. We don't have any more questions submitted for now, and I don't see anyone's hand raised. So perhaps it's a good time to launch a poll question. Oh, and just like that. So how many SIOP meetings have you attended? Yeah, we're just interested in how many you've attended, perhaps total. So is that 1, 2, 3 or more?
Yeah, I think that the topic on the virtual Congress came up in one of the questions, right? Maybe after we have the results of this, we can get back to that, because that is giving us a lot of discussion, and we have not decided yet what will be our next step. So it will be great to hear from you.
Sure. Well, I guess that question is also quite related to this one in that we don't specify whether these are in-person or virtual attendee of meetings, because we have a lot of webinars. So yeah, if anyone wants to share their thoughts on SIOP meetings, either in person or virtual or otherwise. And Guillermo, maybe we could go to you. I know that Anelia shared the registration for virtual attendance for this year's Congress, but perhaps you can talk a little bit about what the future of our virtual Congresses might look like. Yeah, I think it's a great opportunity. I'm glad. I don't remember who brought that question up, but I think it's really something we are discussing at the SIOP board, because during the pandemic years, we started to offer this virtual opportunity. At those years, that was the only thing we could do. So we went virtually to Hawaii and virtually
to Ottawa. But now that we can do it, the in-person meetings, I would say like 90% of the societies have abandoned what we call the hybrid format, and they are just offering in-person attendance. We decided that because SIOP is so diverse and there are many colleagues from low-income countries that could find it difficult to afford going to the meeting, and also colleagues in high-income countries that signed up, that we would like to keep our format of with a hybrid offering. So the model, that it is now, is that probably if you ever join online, you see that you have the whole Congress live. It's like you were there, so you can just pick the session that you would like to attend. You can do it live at the same time as the meeting is being held. You can ask questions. It's like you were there, and then you can access the content for 3 months in the SIOP app. That is really exciting. I really like the quality of the video was really great. It was really like being there, and but the issue is that with time, that these are the things that I can't interpret from the market. Why it is now costing almost 3 times what it costed to us in the past. So I always heard that as internet grows, it will get cheaper, but it doesn't happen to be this way for this. So now it is really becoming a big expense for SIOP. If we do it, we will have to charge a very high registration rate, which will make this, our aim is to reach low and middle income countries. But if you have to pay 500 euros or 1,000 euros for registering to a virtual Congress, probably we are not going to be successful in reaching that goal. So we are evaluating many options for that. Of course, we try to negotiate and have a lower price, but that is not making too much difference. And we can do what other societies did, even the COG, for example, no more virtual Congress, and all you will be able to have is that you can access the recordings later on. Or what another option we are discussing is that not to have the whole Congress, but still have some important, or I would say important, all of them are important, but more well-attended, better attended sessions only. So that will have a cost for that. So we are working on that. We haven't decided yet. For this year in Ottawa, it will be like in Barcelona. So we are going to offer, even if we are not going to get any, not even profit, we are going to pay from our own reserves to make it available. And we have some support from other institutions that could be supporting the Congress, but we need to take a decision for the future. We need to reformat or either abandon or reformat the way we present the virtual Congress. So it is great if you'd like to make a comment on this. How do you? I see that many of you that I know and others that I don't know are probably coming from low and middle income countries. What is your expectation from our virtual contents? And Julia, would you like to add anything else?
Sure. Let me just add 2 qualifications. The price that's really high is if we stream all sessions, which is what we've done in the past and we'll do at Ottawa, at live time. So that if you were at home, you'd be allowed to ask a question. I think you can write in on the chat a question to the speaker at the time. That's because the bandwidth to stream in every room for every session and a bandwidth strong enough to do proper streaming so the person is heard smoothly, clearly, is really expensive. But the point we think of is, for example, if this is live streaming from Canada, probably people who are asleep in Africa and asleep in Europe are not likely to get up in the middle of the night to watch a live streaming, or even in Southeast Asia. They might see part of it when they're maybe after work or before work, but the majority of it is a time zone when they're asleep. So does it make sense to really spend that much money and raise registration to do live streaming when a huge part, no matter where it is, of the world will not be awake? Or does it make sense to perhaps do a hybrid, as Guillermo said, live stream the keynotes and the symposium, which are the big ones, and then the rest of it, record it and give people, for a reasonable registration, lower registration fees, a chance to access those talks for 3 months. That seems like that makes more sense. And then the cheapest of all would be everything's recorded and people can see it whenever they want in 3 months after, if they pay the virtual registration fee. So that's the kind of decisions that the board is trying to consider, and we'd love to hear. We really see that it's almost impossible for many low and middle income country folks to generate the money and the visa to go to the Congress live. We reckon wherever it is. It's just to fly now after COVID is even more expensive than before. And lodging is more expensive and food is more expensive. It's catastrophic in many countries. The change has been, it's almost doubled in some places. So we don't think we can get rid of the virtual at all, because then we are saying, well, no access, too bad if you can't pay that kind of money. So we want to come up with a solution that is reasonable for the majority of our membership. And I'll be quiet now so we can hear from the folks in the comments.
Thank you, Julia. That's great. Yes, we do have some comments from our members already. Neil says, please don't drop the virtual element of the Congress. That would be terrible. Trin says, difficult decision, and totally agree with the aim to include representatives from LMIC through online, so to keep the price low. And yes, better to select and keep the price low. So there's some agreement there. And a follow-up comment saying, yes, live stream is not crucial. Very good ideas. I would be in favor of keynotes and symposia live only if funding allows, and encourage organizing separate sessions, symposia showing a selection of presentations. I'll just find Trian in the audience and allow them to unmute so that we can, so lots of good thoughts there.
Yeah, welcome, Trian. Now.
Thank you so much. Well, only to say that I totally agree with all your thoughts. I think it's great to have some presentations available, recorded a couple of months later, which allows groups or individuals or institutions to have an afternoon, the best of SIOP, or the most relevant for us from SIOP, or something like that. I think that's great. And I think there's a lot of opportunity there. And otherwise, I agree 100% with all your considerations according to cost. Priority to make it available for lower middle income countries. And then if you can keep the price low and still have the keynote lectures and symposia live, that's great, because it's a bit of SIOP feel. But I would give priority to have the recordings available 3 months later and then make your own pick. Because I think, as you're saying, daily life when you're not at a conference creates that usually it's not that much of a priority to sit there and then to listen to something live, actually. I hope this helps.
Yeah, helps a lot, Trian. Thank you very much. And also another opportunity that we could have by this, having like a time zone compliant, I would say, proposal, is that we can even do it in other languages. And so there might be like the best of SIOP where you can interact with someone speaking Spanish or Portuguese, for example. And so I think that will probably, we think that this is probably the way to go. It's a big of more organized time, but that will really be more helpful to our users, to our members. Yes. Yes, Julie.
I'll jump in. The nursing did a Spanish best of SIOP. They did 2 different sessions. There was one talk by a nurse who did not, who did not speak Spanish, and she was dubbed. So her video recording of her talk was dubbed so that it was spoken in Spanish by one of the translators. So we thought, and it was very well attended, and the nurses were really grateful because the Latin American nurses in particular do not tend to speak English and feel excluded from the Congress. And we had seen that in comments from the members. Also, I think, Guillermo, did you run the Spanish for the physicians this year, Best of SIOP for SLOB? How did you do that?
Yeah, it was, we picked, it was made by Claudia Sampor this year. I think there were 2 sessions. They just picked the ones that were interacting with some other Spanish or Portuguese speaking people, and then put them on the different time and in Spanish or Portuguese. It was very well attended, like maybe around 200 to 300 people. I see that here there is some colleagues from Latin America, probably they could attend. It was really good. And that is, in fact, we like kind of did like a pilot with these formats, thinking that sooner or later we were going to have to take this decision, because we were seeing that what other societies was doing with not providing any virtual experience, which we don't want to do. And I think that is really a good option. Yeah, thank you.
Oh, Larry has commented that Asia Congress in Yerevan, Armenia, had speakers presenting on Zoom, and it was seamless.
So in other words, Larry, do you mean that you could be at home in, say, Egypt, and you could watch Yerevan, the Congress in Yerevan, and you could watch it live and it was no problem?
Welcome to all. I was saying if the time slot is well predefined, that there's going to be a session by Dr. or Mr. from the speaker at that particular time zone, then if you give a Zoom link of that time zone, anybody who is available at that time can join on Zoom and also be a part of that session, and would be knowing this pre-hand, that this session is going to be at this time, and it would be good if I be present and listen to it.
Perfect. Yeah, that's live. So that would qualify as live streaming. That's what's costing us so much money if we go for the whole Congress, because so many sessions are running in parallel. But I'm really happy to hear that it was successful in SIOP Asia and that you guys could link in and see it perfectly. So that's why we thought maybe to save some money, if the membership thought this was a good idea, was the big talks would be live streamed in that time slot for those that could join the keynotes and the symposium, but that all the other tracks would be just recorded and people could access them as they want. I suspect because of the unbelievable cost of live streaming the entire Congress, that's how we'll have to go, just to keep the registration low for virtual. Was your registration, if you didn't attend in person, cheaper if you did it virtually? Was it a lower cost?
I had attended live, so I'm not sure about the virtual attendance.
Okay.
And on this topic, Neil poses an interesting question of, is there a way of seeing how many comments or questions there were from virtual attendees during Barcelona? Do we have any engagement metrics for the people who joined online?
It's a good question, Neil, and we'll have to get back to you, but it's a very good question. I think it's generally low because some people have a hard time getting connected and staying connected and then having their mics open. Usually I think, and correct me if I'm wrong, Guillermo, that the people running the tech during the session have to inform the moderator that there's a question from the audience, from the virtual audience. I think I remember being in sessions where they did say that and they were brought forward, but I don't know if they were counted. We could certainly ask.
No, we had like an iPad for the coordinator. It was the medical nurse, whoever, not the technical people who got the question. What we had was like for the chairpersons, we gave the note that they have to take care of the virtual questions, so they knew how to look at the iPad. But it was the chair of the session that has to be aware of that. Yeah. And
Then
they
we
were
should-
quite, yeah,
There
there
were a
were
lot-
many questions. Yeah, well, a lot. Yeah, yeah.
Well, this just goes to show you how little of the conference I was able to see because we were in so many meetings. So I can't wait to get to this year and actually be able
Yeah.
to attend the sessions. That's great. So
Yeah.
Neil, we'll find out. We'll ask. As Anelia, we'll make a note that we'll try to see if we can see the quantity of questions that were asked. And maybe some sessions had more virtual than other ones. But I think the chance to participate, if you're in that time zone, and let's face it, with all due respect, we may not be the largest population, but the Western Hemisphere, Canada, North America, South America, Central America, and the Caribbean is a large group of people. So they could potentially participate in virtual and have questions. And so.
Yeah. And next year we are facing a Congress in Hawaii with a very difficult time zone. So another factor to consider just for next year. So thanks for your comments. And anyone else would like to make any comments?
There is question from Trin. To you, Julia and Guillermo, what is mostly as board members keeping you busy? GICC, Vision, Congress, administrative tasks, or other? What can members or others do to help increase the impact, especially for GICC Global? That's question from Trin.
Yeah, I would, if you ask Julia what is keeping you busy, you would say Guillermo. If you ask Guillermo what is keeping you busy, I would say Julia. So, so that's a great question, Trey.
I could say one thing, you know, the GICC, I think we could tell you that the advocacy committee, and here comes Alan. Alan, do you want to say something first? Because I think you're going to probably say what I'm saying. Can you let Alan speak?
I believe he has permission. You just need to yeah, there you go.
There you go.
I was actually, Julia, you should say what you're about to say, and then I can comment.
Okay. So I'm grateful that you're here. So the advocacy committee, which was reformed, it had been started under Gabby Kalaminas years ago, but it reformed under Kathy and the new strategy. And their time was being consumed by the WHO, GICC, and our relationship as non-state actors in official relations with WHO. So earlier this year, Guillermo asked Cassie to head up a provisional committee to focus only on the WHO issues and initiatives. And that's in place for 2 years. It was the members, it did not go to general election. People were picked specifically, it's a very small group, it's about 5 or 6 people, specifically because of the work plan that we have as SIOP with WHO and the GICC. So for example, Gilles Vassal is on it because he works in essential medicines with SIOP-E. The nursing committee nominated me to be on there for nursing issues. And Lorna Renner is there, and Oscar Ramirez from Lorna Renner from Ghana and Oscar Ramirez from Mexico, because both of them had a long history of working with their regional WHO offices. So this is a very, I think I mentioned everyone, but this group answers directly, this committee answers directly to the advocacy chair. It is not a board level committee. And it's to see if it should stand after 2 years, and then it would probably be reconfigured again. But it became so much attention, required so much attention, it was crushing everything else advocacy was doing. So let me give it over to Alan so he can tell you more.
It's a useful segue. I mean, I have to say, Train, there's wonderful voluntarism in the community, not just the organization, but the community as a whole. And Julia's sketched out very tidily what's happening kind of at high level, if I can put it that way. High level, you can, I mean, is what it is. Trying to move advocacy through various structures, whether it's WHO or otherwise. But actually, there's no substitute for action on the ground. And often people ask me the question you've asked now, which is, what can I do? I've had colleagues, what can I do? And I say the same thing to all of them, work through structures. So the best thing you can do, I don't mean Train, I mean one, is first of all, be active in your country and try and get your country in whatever form or fashion you can do as a GICC focused country. Now, that's not an easy task. That is a whole lot of riders and provisions. Secondly, so interact inside your country within the local structures, whether you're doing it from a nursing point of view or young SIOP or as a researcher or with whatever hat you carry, and then equally make sure that your country is operating inside the continent so that you whoever you are, whether you're Tanzania or Indonesia, are making sure that your continental president knows what's going on in your country and can help where possible. And in that way, if we work through the structures that are there, because in fact we've created quite a diverse network, both from a competency and a geographical diversity basis of structures, we can kind of keep tabs on each other, and that's all about helping, just about moving the needle collectively. But you know, I think the think global, act local message is perhaps strongest in this space. You know, that doesn't mean that that senior leadership in whatever form or fashion isn't, hopefully is accessible, not isn't, is accessible in spaces like this. And this to me is a very exciting development, allowing people to interact with in this case the president and the general secretary. Gosh, that's a lot of words, Julia. I should be quiet now.
I have to apologize because I did forget one member of the WHO Provisional Committee, and that is Venkatraman Radhakrishnan. And I believe he's representing, can't remember, I'm sorry, I can't remember who he's representing, but that is the last member of that committee, because I want to make sure that we have him noted as well. And I think that leads into what Alan just said, is a reinforcement of what we said earlier, that the continental and regional branches of SIOP are getting stronger and stronger and becoming more integrated into the SIOP leadership and engagement in all of these issues that come up. I can tell you that what keeps us busy are usually things that come up unexpectedly. We get, as Guillermo mentioned, we get requests from the outside for all, and it isn't just, please let me get into the Congress for free, or I have, I want you to endorse our Congress. We have so many ways now that we try to be more organized. So for example, if you want to have, you're doing a Congress locally, or you're doing a webinar, or you're doing a seminar or an educational program, you want SIOP to endorse it, we have you can click on a button on the website now and you can ask for it on a short form. On the other hand, We have requests for, should we make a statement about a crisis that's happened, like the earthquake in Turkey and Syria that was so devastating? And how do we acknowledge world events in a way that's fair and related to childhood cancer? You know, we try to keep our response apolitical if we can, but focused on what our mission is, which is the care of children and adolescents with cancer. But we do try to respond because we, you know, things happen in the world that are horrible and affect our patient population. And that's our purpose and our raison d'etre for being here as a society. So we think about how best to do those kinds of things. We have requests for support. We don't have big coffers, and so we have to decide how best to give that support, or we get a request from WHO, as Guillermo mentioned, one country sent us their NCCP plan, but we get other requests for technical support. Then we think, who would be the best person and the best expert in the SIOP community to address this? And we have the ARIA program now, a huge collaboration on adaptive treatment guidelines and how to get the SIOP membership engaged in that as well, in a transparent and inclusive way. So all of those things, just when you think you've set aside the time to take care of some of the less interesting but critically important governance policies, procedures, something will pop up and you have to take care of it. But we do reach out. So, you know, we do reach out to experts in the SIOP community because we couldn't do it without you. There's no way the board can and the secretariat can handle everything that and all the requests that we get. Alan, do you have something else to share? Or is that an old hand?
No, it's new, and it's by and forgive me, Guillermo, for hogging the mic. I'm going to put the talking stick down now, but a shout out to the General Secretary who picked up. This is an example, guys, and it's also a call to those on the call. Is a member from Japan asked in an AGM a couple of years back, what are you guys doing about smoking? That's a fair question in a cancer organization. And the General Secretary picked it up, and we have run some in a subcommittee of advocacy with that particular angle. And there's a statement out 31st of May, for those of you who may have seen it in social media, on tobacco and smoking and so on. It's not a main focus, so don't be alarmed that we are running into the sunset with other issues, but we do see those as part of our mission. So that's the point, is, as Julia says, it's not just about whether I get, you know, those sort of queries, but this is the kind of query that members can reasonably come through the various email channels or through the Secretariat or at AGMs and ask, what are you guys doing about X, Y, Z? And we have to look at it, and then we have to look at this, at the rubric we've created around statements, because the Ukraine crisis did create it made us super aware of where the organization stands on all kinds of crises. And so now we have a guideline that guides us in terms of being fair and equitable for, you know, for any kind of crisis that we asked to make a statement on. So so what I'm saying to members in the meeting is, if you have things, even if you think they might be a bit peripheral, but it's close to your heart, you can send it to us, and, you know, be assured we'll look. And if we feel that we can just move the needle a little bit, we will get involved. And with that, I'm not going to speak again. Thank you, Julie.
No, we
No,
appreciate your input. Go ahead, Guillermo.
Yeah, of course, Alan. Thank you very much. It was great thoughts. And let me add just one more thing, is that we have a really efficient secretariat. And so we have 4 people now working for SIOP under the direction of Suzanne, and that they really make our job easier, and they are time savers for all of us, and they work really efficiently. And, you know, Nancy is with SIOP less than a year ago, and we have now a very strong communication manager, and that is also something that is probably not taking time from the board, but is taking a SIOP role very efficiently. So, and Tessie is working on projects and networks, and Anidia is giving support to the three of them. So it's really, SIOP grew also in that direction, and they do a really very efficient job.
Yeah, let me tag on to that. We had a large newsletter that used to come out quarterly, pardon me, and people, it was really dense. And I doubt many people read all of it, although clearly people did. But since Nancy's come, it changed to a weekly bulletin. It comes out on, I think, in my time zone, it comes out on Thursday. I think for others, it comes out on Friday. But when we did the membership survey and we asked people, how often do you want to hear from SIOP? It was overwhelmingly weekly. So Nancy really had her finger on the pulse. It also, people responded about whether or not they use WhatsApp, if they use Twitter, if they use Facebook, how they like to be communicated with. And I think this is something SIOP takes very seriously, because on the one hand, we want to be communicative, but we don't want to overwhelm people with lots and lots of communications that are not meaningful for them, one. And two, but give enough information that they feel that they know what's going on at SIOP and all the places they might get involved. I think that we've also done a lot of work over the last 3 years to refresh the steering committees, the steering groups of the various committees and networks, and give other members a chance to participate in SIOP leadership in that form. And that means running a lot of elections, which is way more than I think we've done in the past. We hope that's clear for folks, and we're going to keep doing that. We're trying to also consolidate what we call like an election period, so people would know in advance. And this is going to take a year or two to smooth out, but it would be something like April, May will be the election time. And then each of those openings coming up for the next year would be having an election then, and people could look down the list and see what is available, because maybe you decide to put your name forward to nominate for something and you find out 3 months later, oh, something else opened that you would have been much more interested in running for that position. So we're trying to make that elections and opportunities to be on steering groups and senior leadership as well, more consistent. We think too that we got more abstracts this year, I think are close to the same as last year. So we're having huge numbers of abstracts. And I would say that running the Congress between Kenneth, which is our management company for the Congress, has been spectacular. And they continue. We have a new contract with them to continue. We get good feedback at the end of the Congress evaluations about their performance. We take every single comment seriously from the evaluation. Everyone on the board has seen it. They've seen all comments. We don't give them just a little summary. Also, I would say that as far as the Congress, the scientific committee, which works really hard, and together with the SPAG, which is the group of reviewers who score all the abstracts, and that they also rotate every 3 years. So the system for setting the Congress, I think, is not burdensome for the board, because between the scientific committee and Kenneth, they really do a terrific job. Of course, they report to the board regularly, and the board is very aware of what they're doing, but it isn't really a lot of hands-on work from the board side. And I'd say that the evaluations last year were pretty darn good. I mean, people were very happy. People are not happy, I'll tell you honestly. They would like coffee 24/7 at the Congress, and they'd like it to be free. We would too, but unfortunately it's really costly. So what we're trying to do is see if we can't add more coffee breaks, at least with coffee, because we know that most of healthcare runs on coffee these days anyway. People also would like more food, but the food, if you pick a venue, the venue usually has caterers who you are only allowed to use. You cannot get a good price. You have to use exactly what their caterers offer. And generally, that is super expensive. It can be as much as $8 or €8 for a sandwich. And that doesn't include a beverage or a bottle of water or a piece of fruit. So we struggle with it, but what we are trying to do is make sure that we are in a place where you don't have to get in a taxi to go get food. And we recognize it. Everybody recognizes it. We also are hearing from our members that being sensitive to the client, to the environment is important. They don't like seeing styrofoam or waste and plastic waste. And I think at Barcelona, people didn't realize that those bags that some people had bagged lunches came in were recycled, and they threw them away by accident because the staff were picking them up and they are reused. So we are conscious of that, and we ask about that when we pick venues. When we go to the site visit, we say, what effort do you make to reduce waste and plastic use and be sensitive to the environment? So we hear the comments, we pay attention to the comments, and we try to act on them. Guillermo, do you have anything else about the Congress?
No, I think you summarize very, very comprehensively. I think it's really what we are making all our efforts, and thanks to the organizing committee, to the LOC, to the scientific committee, and to Kenneth, it's not a big burden to the board. They are very professional. They are doing really a great job on that. Yeah.
Thank you both. There was lots of lovely comments and acknowledgements in there, so thank you. I think that was a really interesting question, actually, about how you spend your time. We don't seem to have any other questions in the chat or the Q&A box at the moment, so unless anybody wants to raise their hand to pose anything. Oh, I saw the Q&A box light up. One last comment from Neil. Can we have a networking event at SIOP that is free and doesn't involve music?
Sorry, I didn't understand. A networking event at SIOP that's free and doesn't include music? Do you mean a networking dinner?
Oh, I'll just unmute him to get further clarification on that.
Coming from Neil, perhaps he's referring.
Oh,
about
come
the
on,
bike.
Neil. Talk to us, man.
Hi. Yeah, can you hear me now? Yeah.
Yeah.
The networking dinner at the Congress is expensive, and also there's quite a lot of drinking, which appeals to some people but doesn't appeal to some people, and there's quite a lot of loud music. So again, this appeals to some people, but for other people it's just sort of no, I'm never going to meet anyone there unless I'm drinking or dancing. So I wondered if we could have another sort of networking event, not necessarily a dinner, where people can meet each other, but they don't have to talk over loud music, and it's free.
Let me ask you, Neil, do you attend the welcome reception after the opening ceremony? Because that's included in the price of the ticket, and I don't think that has music, and it does have food.
You're right. Yeah, I do. Yeah, that's right.
Okay.
Yeah.
I have hearing aids, and the music is very difficult for me, but I recognize that there are people, and my husband's one of them, who look forward all year to dancing at the networking dinner. So usually I tell him, I'll meet you later back at the hotel room, because he thinks that is the most fun thing that SIOP does. And I know there's a dedicated group of folks for whom that is a big and important part of, I think, unless
yeah. I wouldn't want to stop that event, but I just wondered if we could have something else. But you're right. Yeah, the welcome after the first ceremony on the opening day. Yeah, that's good. Yeah.
Alan would like to. Oh, he's raising hand. Maybe to answer.
Okay.
Yeah, and I promised to shut up, but I'm gonna respond to Neil. Hell, that's a good point, Neil. Jeez, man. We had in the last couple of years in the hybrid sort of can I call it iteration of the meeting, we had the coffee, the early morning, whenever that was, because of course Ottawa wasn't early morning out here, and certainly not in South Asia, but we had coffee where the president was Kathy, and I think also the GenSec, Julia, where you guys would hang out with members, that sort of notion. Now, we could do that live or hybrid. I mean, in a truncated version of the hybrid offering, we could have a sort of a coffee or I don't know. I mean, because I think the idea is fabulous, and Neil is right. On the one hand, I'm with Pete. That, by the way, is Julia's husband, on dancing at the networking event. But I get the point that actually what Neil's saying is the networking event is fun, but it may not necessarily encourage networking in the way that we historically understand. So that's great food for thought. We should take that back and think about how we can somewhere in a very busy program structure a space where, and I'm thinking particularly of members who are not hooked in, who don't know everyone, who can come and, you know, and hang out like a coffee lounge sort of thing with everyone for 45 minutes or an hour and meet people. It's a really cool idea.
And maybe
oh, sorry. Something we try to do related to that is to have like some food or some drinks in the poster session. So it was not it was not just, it was a little bit of work. In fact, it was not just for fun, because you still have to go to look at the posters, maybe. But we try to enforce networking at that time as well. I'm also concerned, as Neil mentioned, about the alcohol, because we are a pediatric oncology society, and as we do for cigarettes, we might be more mindful for alcohol. Even though I can say that after Barcelona, because we already had the cava and everything, but and I wouldn't say no to a glass of wine, but I think that it's a great point, Neil. So thank you very much for raising that.
Yeah. Thank you, Neil, for raising this question. And actually, there is one possibility for free meeting rooms. We've just launched a survey link. SIOP will make a limited number of meeting rooms available, which will be free of charge only to SIOP members during the educational day. So we've circulated this through our weekly bulletin as well. So only SIOP members could apply for this option. And yeah, maybe it's a chance for like small meeting rooms and small meetings for different groups as well. Yes.
Thanks, Anelia. I think too, I asked last year for us to, because it was impossible, unless you knew what my face looked like, that I was Secretary General, it was hard to know who was who if you wanted to talk to a board member. And we feel like SIOP members who come to the Congress or attend virtually could see who is a board member. So we did the little ribbons. We had the little ribbons that we could add to our badges so that people would know this is a board member, this is a chair of a committee member, this is a scientific committee member, whatever. So I'm hoping that by tagging our name tags, by putting the ribbons on our name tags, that members will be able to see, or attendees will be able to see, who come to the Congress, who they could talk to if they have a suggestion, a question. I think maybe we could advertise that welcome ceremony, Neil, is also a chance for networking and not just drinking and eating, because I think that's something, the fact that it's called a networking dinner, I think Suzanne's told me it has to do with something, a reason we have to have that name on it for the way we get accredited. But I think that it is something, it's been very different in over years that it's been given in each country, and it does cost something. I don't know how to get it sponsored. It would be great if a big company wanted to sponsor us to do it for free, but so far we haven't been able to find that kind of money. Some people are not interested and some people have gone home. I think you're right. We try to keep it low. I remember one year, I think it was in not Kyoto, I think it was Yokohama, there was going to be sushi and it was really expensive. And they decided at the last minute they would change the menu and they were going to make it more reasonable, and they cut it in half. But I think it's something for us to keep mindful of, I should say, definitely.
Yeah, thank you. And it's not that SIOP gets any money from that dinner. It's we charge what we spend. It's not that because other societies, I know they charge very high because it's a part of their revenue, but it's not from us. It's usually what we will spend, what we will spend on the dinner.
So I just want to also mention some other initiatives that SIOP is taking on. And I think that we should discuss for a minute our role in GICC. Guillermo, could you give your idea about how we fit into this really global, it's so big now and so many countries are signing on. How can SIOP make a difference or really put our shoulder into the GICC? Because I think I get a lot of questions about that. What really is it if their country isn't chosen, or even if their country is chosen?
Oh yeah, that's a great point, Julia. In fact, that's a question I also receive myself as well. And so sometimes some people say, well, my country is not participating in GICC. How do I do? And they come to SIOP. And first, going back, SIOP is a non-state actor with the WHO in formal relations with WHO. And that status is applied to our role in GICC, which is the Global Initiative for Childhood Cancer. Sorry. And so that is how the work, that is what we do is entitled. So we are partners here with the WHO for supporting the program, the GICC. The way we do it is many folds. On one hand, we work with the WHO on occasions for supporting different statements or different activities of the WHO that are important for them and then for us. And other times we give technical advice. For example, there are technical packages from the WHO to how to, for the policymakers, how to create a retinoblastoma plan, a national retinoblastoma plan, or a national Wilms tumor plan. So the WHO comes to SIOP for advice, for technical advice on that. Also, we interact by other SIOP programs like PARC, like ARIA, for example, for the GICC mission. And lastly, our continental branches are very active on that. For example, in Latin America, we have PAHO, which is the WHO for pediatrics in general, which is very related to us and to SIOP and to WHO and also to SLAO. So our relationship is multi-dimensional. It takes a lot of our time and resources and brains and members' input. So this is really what we want to do. Of course, this is a major program, and we offer to our members the possibility of getting together with the national societies or governments, etc., for us to provide support when they don't have. Sometimes they do have their own, some countries they don't. So like we said, we are analyzing a cancer plan for a country that didn't have a local society for giving advice. So we can do support in many different layers to the GICC.
Guillermo, can you explain PARC? Because some people may not be familiar with it. And it's
Oh, yeah,
spelled
sure.
P-A-R-C, guys, not P-A-R-K. It's P-A-R-C, but go ahead.
Yeah, well, PARC is a program that SIOP has for advancing research support, research capacity mostly in low and middle income countries. So we, thanks to a donation we obtained from Amazon at the first time, we approached the cooperative groups in different regions. That was the first decision we took. We say, how are we going to implement the use of this money? Who are we going to support with that? Are we going to support the continental branches? Are we going to create new cooperative groups to support research? So what we decided to do is that we will support the already existent cooperative groups. Our money was not unlimited, so we said, let's start with the ones that are international, the ones that are already running, the ones that can give us a track record of success, and ask them what they need and try to support them. That is what we did. We are supporting 4 cooperative groups in different continents for them to enhance their research capacities. Not that we support a protocol, we support the group, for example, to become a legal entity, to be able to share data with other countries or other groups, to hire a data manager, a research assistant, etc. So that is what PARC is doing. And it is really very rewarding because we now have other 2 groups that we are going to support. We have more funding, and we interacted very well with GICC on that, because the WHO released also like a year ago a resolution about how the countries should support clinical research, and that came exactly to PARC, because that is what our members are using to go to the ministries of health, to the hospital administrators, to say, well, you have to support us, you have to support the clinical research. So that is what PARC is doing. It's a program for advancing research capacity. That's the acronym.
Let me just qualify too. It's competitive. The application for a PARC grant is competitive. There's a call each year. And then there's a selection committee and also it's not for high income countries, right? It's high income countries are not eligible. And the PARC committee how was the PARC committee chosen? It's a large committee, isn't it? It's about 10 people?
Yeah, around 10 people. Yeah, we decided we try to be as inclusive as possible, to have gender balanced and continent balanced and some disciplines balanced. So we have representation from CCI, representation from nurses, representation from different continents. So it has been really a very productive group, the PARC committee. It involves also people from high-income countries as well, and which were related to research in low and middle-income countries, of course, who could be, for example, people like Greg Riemann that work at the FDA, very deep knowledge about what is going to be done in research in low and middle-income countries. So very high qualified people are taking part of PARC.
Okay, so now if I don't have another question, I'm going to switch to another question we get a lot, which is educational opportunities and mid-career members of SIOP. So we recognize there's been a lot of effort made for young SIOP, which is now almost a larger group of members than the physicians in general. That's how big young SIOP is now. But that ends when you're 40. So there's a group of physicians and nurses and allied health professionals who are over 40, but not anywhere near retirement. So let's call it they say we're mid-career. And they say that they would like opportunities for specialization training. So they're already functioned as pediatric oncologists or pediatric oncology nurses, but they want to perhaps specialize in more recent techniques in brain tumors or in retinoblastoma, but there's no opportunity for that they can see in their region per se or in other countries. So one of the things SIOP is now considering, we have the new prize, the new award for young SIOP, and that came out recently, and that was also competitive. That's been chosen to be announced in Congress. But thinking now about what about mid-career members of SIOP and what could we offer them? And we don't have the money to run our own programs, and why would we as a society try to do that when there are excellent programs elsewhere? So I think, Guillermo, you've been through SLOP and other groups thinking about how could we to get access to or create a partnership with, or perhaps highlight what's existing educational specialization programs that we don't have to reinvent and do it ourselves. Would that fair to say?
Yeah, absolutely. And we are going to offer some career development awards to middle income to middle career colleagues that are working with PARC. So we are very actively working. Hope we can announce formally in Ottawa, and so that is something that we think it's an unmet need yet. It's not that we are not doing anything, because the Congress is the biggest program, the biggest project for mid-career people. But I think we can do more, and that is what Julia is saying. Absolutely.
We're looking at our education and training committee, and we're thinking about how it could be. It was a brand new committee 2 years ago, and Sagir Khan, who is a member of the board, and he ran the CEDAR program, who many of you may have seen that program, which is now on YouTube. Maybe Nancy can put the link in the chat, which was a program with early diagnosis that we did in collaboration with the International Pediatric Association, an enormous association across the world. And they were very happy about it, because it was really speaking about how general pediatricians, general community health nurses, general healthcare, primary healthcare workers can be better informed about early diagnosis to try to help us in many countries where these kids are just coming with too advanced disease. So that's another example of, we're getting more and more official partnerships. We have another partnership now, we call them strategic alliances. We have a formal strategic alliance with IPOG, which is a group that was formed by Lee Dupuy out of Canada and Wim Tissing out of the Netherlands initially several years ago. Lillian Sung, who you may know, is a member of that. And they reached out to do a strategic alliance with SIOP. For their focus is supportive care. And that was very welcome. And they had not really done much work about countries with limited resources, and they were interested in expanding that. We have two representatives, Regine Kabudi and Michael Sullivan, we call them external representatives for IPOG. And that is something else we've started to create. So if you know of other groups that you think, associations, professional associations, who you work with children with cancer or have relevance for children in general and adolescents, please let us know. And we would consider that, how we might do joint projects or have a strategic alliance with them. That's a new something. And finally, before the time runs out, Guillermo, do you want to mention mapping? Because that's a big program many people may have heard of, and it would be great to just give them an update on that.
Oh yeah, great. Just in the very last minutes, SIOP is actively working in a global mapping of pediatric oncology resources all over the world. And this is really a major task to be able to map effectively where are the resources on pediatric oncology worldwide. We have done, the initial work was done in Africa, and it has already been published. In fact, in half an hour, we have a meeting also for the Brazil group in the mapping in Latin America that is almost done. We almost finished Latin America. We have just a few institutions from Brazil and Mexico to join. This is including like almost more than 250 institutions, right, Julia, that we screened. So in a few words, what we ask is very easy questions, 10 questions about where is your institution, how many patients you see, how many nurses you have, how many beds you have, if you have different, how the center is financed, etc. So there are 10 questions, relatively easy, meant to be the first step and then to scale up from that. For example, The next step from the GICC will be the mapping on the services that are in GICC and how they are performing now after GICC. Well, we already have the list, and that is why this is so important, because now you are on the map. You are in the center that is working. Perhaps it's a small center in a small country. It doesn't matter. The center is listed, can be found by the WHO, by SIOP, but by different bodies of work that are interested in your work. And so that is really the aim. The next step, or it's not next, we are now doing Asia, and which is the biggest challenge because of the size and the diversity. And we have now a medical director also for this program. And this is a very ambitious one and a lot of effort that we are putting. And you're going to see the first results also near Ottawa. And you can get the online mapping, so you can just click and see in the world which are the centers that are mapped.
Yes, we should put a shout out. Scott Howard and his company Resonance is partnering with SIOP to do this and managing the data, thank goodness. And we're in the process, they are in the process of creating the first map, the early map, but we're finished. As soon as we finish the rest of Latin America, we'll show Africa and Latin America, and there'll be little points for each center that has agreed to be on the map. And so people, for example, a parent who is maybe looking for a facility could click on that map, and it will be on the SIOP website, and I think on the Resonance website, and you could click on it and see the name of the hospital that offers care for children with cancer and the contact information to get to that hospital. So it'll be really exciting. It's been a long, long journey. It's been several years, but as everyone knows, unfortunately, surveys are not everybody's favorites. So that's where we dropped. The African survey was very large, and we were amazed at how we were able to get so many responders, but it was a big effort. So now we dropped to 10 key questions to get the map up and live. And then we'll go further with that. As Guillermo says, WHO is really interested. I have to thank everybody. I'm going to just say thank you and then let Guillermo close us out, because it's been fantastic having you here, and we really appreciate you taking the time to join us and give us your comments, your thoughts, and hope you'll communicate with us in the future as well. Guillermo?
Oh, thank you very much for being with us today. We are here. Just come, just ask your questions. We hear them all. We discuss, we take it seriously. And it is a great pleasure for us to be serving you as SIOP members and trying to make our society better every day. So thank you very much, and I look forward to meeting you in Ottawa.
Thank you. Bye-bye.